Dementia is not a normal part of aging. As we get older, beginning in our 40s and 50s, it's completely normal to see some type of age-related cognitive decline or age-associated cognitive impairment. Things like going to the grocery store and forgetting where you parked the car, or misplacing the remote control at home, which, let's be honest, happens to the best of us. But it's important to know how these types of symptoms fit into what's known as the cognitive continuum. Let's start with mild cognitive impairment, or MCI. Here, we're talking about seeing evidence of a modest level of cognitive decline, but these deficits aren't enough to get in the way of living independently. Patients with MCI might have difficulty recalling previously known tasks like forgetting routines or having difficulty navigating traffic and multitasking. But MCI isn't just about memory. It might also include problems with language, judgment, executive reasoning, or abstract thinking. When MCI progresses to the point of seeing evidence of a substantial cognitive decline, where these deficits prevent people from living independently, we've moved into dementia. These are things like forgetting you even know how to drive or forgetting the names of close family members. While MCI affects about 15 to 20% of people in the United States over the age of 65, research shows that up to 40% of patients, or about 1 in 3, can revert back to normal by modifying certain medical and lifestyle-associated risk factors. And only about 12% of MCI cases each year progress to dementia. So, what can we do to save our brains? The good news is that it's never too early or too late to do something. Most people are diagnosed with dementia when it's moderate or advanced, but predementia or MCI is generally diagnosed 5 years before dementia, which means there's something we can do to change it. By managing risk factors, building cognitive reserve, and removing offending medications. What's good for the heart is good for the brain. Did you know 40% of all dementias can be prevented by managing 12 risk factors, which include higher education, hearing loss, traumatic brain injury, hypertension management, alcohol, obesity, smoking, depression, social isolation, physical inactivity, air pollution, and diabetes. Building cognitive reserve, which means doing things to build more brain cells and brain cell connections, called neuroplasticity, is another key factor in reducing the risk of dementia. As a society, we're used to the magic bullet of medication or surgery, but for dementia prevention, it doesn't exist. It takes the work of eating well, moving more, staying sharp, being social, and making sleep a priority. And finally, let's look at removing offending medications, namely anticholinergics. Acetylcholine is a chemical in our brains that's needed to form new memories. So taking medicines that block or reduce acetylcholine can have detrimental effects on our brain health. One of the most common anticholinergic medications is diphenhydramine, which is an ingredient found in Benadryl and many sleep aids. But those aren't the only ones. If you're not sure if any of the medications you're currently taking contain anticholinergic components, make a list of your medications and speak with your healthcare provider or pharmacist to see if there's an alternative. So remember, managing risk factors, building cognitive reserve, and removing offending medications can go a long way to preventing dementia. It takes some work, but to save your brain, it's absolutely worth it.